BioBalance Healthcast, episode 126, Patient-Centered Medicine.
BioBalance Healthcast features conversations about positive aging. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor.
We're having a series of conversations about medical care and the status of medical care in the United States and where it needs to go. And for some of our audience, and for us as well, aspects of this conversation are depressing. Aspects of the conversation are frustrating. But it is a conversation that needs to be had, whether it's depressing or frustrating or not, because they're very real problems, and these problems have to have solutions. And in my business, mental health counseling, one of the issues that comes up regularly in dealing with people is that so many Americans are conflict avoidant. We like to do what we can to avoid the cutting edge of intense feelings. It upsets us, and so we just want to pretend that it's not there, and that it'll just get better if we just sleep on it, or if we take a break, or if we cross our fingers, or whatever magical thinking we might be doing, that it'll just go away. This problem isn't going to just go away. It's going to get more intense as the baby boomer population ages, and as our government attempts to find solutions for dealing with that. And those of us who are the ones being dealt with are going to be the passive recipients, or we're going to be the active participants. And so Kathy and I are trying to have some conversations to stimulate you to do some thinking, and maybe to do some proactive things in terms of your own education, conversations you're having with your physician, participation in the government as a democratic citizen. So whatever side of the coin you come down on, what our hope is that you will be active as a participant in the dialogue. Help us as a community find a good solution.
It's hard to talk about things that aren't uplifting and that aren't
nice and fuzzy.
Oh, I can fix that, because I mean, as a physician, I'm supposed to be able to fix things.
Yeah.
And I have I have a practice that doesn't take insurance because I've dealt with them for so long.
Yeah.
And
so do I.
They have taken away my time, my energy, my money, my frustration. I have hit a wall, and I finally said I can't do this anymore.
Yeah.
Thankfully, I was called to do something else.
Yeah.
So taking care of bioidentical hormone replacement is a positive for my patients, but it's also positive financially for them, because by investing now in their health, then it prevents them from having many diseases later. So in my world, I conflict avoided the insurance companies. I don't have any contracts with them, thank God. And I now have contracts with just my patients, which I find to be much more ethical.
Yes.
And by making them healthier, or helping them make themselves healthier, to me, that helps decrease the dollars spent on each of them later, or that they'd have to spend on themselves.
It does that, and it also fits more directly with the Hippocratic Oath that you took. It allows you to consider the dynamic between you and the patient, and first, do no harm.
Right. Do no harm is the first thing in the Hippocratic Oath that we all agree to, and that means if we have any choice, if we have in our knowledge, if in risk-benefit ratios, nothing's perfect. But if you always take something that's lower risk for your patient than higher risk, then you should be doing no harm.
Right.
You know, if the two choices are there. So that's part of do no harm. It doesn't always work in reality, because sometimes you don't do it, but sometimes people have bad outcomes, and they find that to be a violation of the oath, but it's really not, because if we're trying to make you better,
right,
and you have a different kind of outcome, we're still trying to make you better in the best way we know how, and that's what we've promised to do, right?
Well, absolutely. I mean, experimenting with informed consent. This is an experimental procedure. We are thinking that there's evidence to support saying this could help you. But here's the risk factor, and any of you have ever had signed surgical consent forms, they're going to tell you that there's a risk that you could die, that you could be crippled, by some random event, and you have to sign that you know that and you've been told that, because the lawyers have helped them all figure that out.
Right.
But what they're also going to tell you is that in their best experience, judgment, and knowledge, the most likely opportunity for you to get better is to have this procedure.
Right.
But you have to be an informed consumer. So do you agree to it or not?
Mm-hmm.
And
it's still your choice.
yeah.
It's still your choice to decide to go with the doctor's advice or not. The second thing that we agree to is to not make a medical decision based on monetary.
Right.
And I mean, that's the second thing we agree to on the Hippocratic Oath. So somebody, tries to sway me to have a patient do one thing, then I'm not supposed to do that if that's not in that patient's best interest. So here's where I think the current future medical care system is violating the oath that every doctor takes.
Well, let's use a specific example that might be appropriate for your practice. If I come in and I talk to you and my symptoms are that I am anxious and depressed, and you look at me and you do the blood test and we do all of the stuff that you normally do for a patient, and your assessment is that what I would benefit from, that would help my anxiety and depression, is replace my testosterone. But the insurance company says, that's not a treatment for depression. That's not even anything that we deal with. Give him an antidepressant and let him go home and get better.
And an antidepressant's only going to make you feel partly better, and it's not going to fix the problem.
And that is what you believe, and that is what your experience shows, and that is what your patients
And lots
say.
of research
but that
shows
is
it
not
too.
what the insurance company will say.
Well, they don't want to agree to anything that costs anything. So that is at cross purposes with my oath. My oath is to treat somebody in the best manner possible.
So
now,
you then will say to me, because you don't deal with insurance companies, here is my advice. Get your testosterone replaced and see if your depression improves. Other things will also improve, given your general health conditions. But it may be that if your depression improves, you can come off of the antidepressant.
Right, and we won't be
not
spending
have
money
those
on
side
that.
effects and not have to spend that money.
Right, and you'll get off all these other medications that you've been on.
Blood pressure
because
medicines.
you'll lose weight and you won't get diabetes and all of those things that were in your future.
Right.
Because there were signs that those things might be developing. We're going to wipe those away because you lose 30 pounds. 30 pounds is 30 pounds. I mean,
Yeah.
that takes diabetes away.
So
There are articles and lots of research that says that this works.
that are on your website.
That are on my website.
People can go and check them out.
And it's for men, it is flying out of the research.
Right.
The research centers that testosterone improves depression. But the insurance companies will take another 10 years to go, oh, yeah, that works.
And then beyond that, they'll take another 10 years to think about if it works for men, perhaps it would work for women.
Yeah, it'll take another 10 years for us. So, it does work for women. So those are. But my decisions are made on what I know and what I've studied, and what the research says, and what I've seen for the last 11 years. It's also, that's why they call it the practice of medicine. Is that even though you read one thing when you're training and somebody tells you that this works, if you try it 10 times and it never works, I'm not going to go that way the next time. I'm going to try a different avenue. So that's why, but that is within the realm of being a doctor.
Being a scientist, you won't look at one data point either.
No.
You'll say, I've tried it with 10 people who are all overweight, and so that's what they have in common. It may still work for these people that are not overweight.
Right, but I'm talking about, but when I look at that, it's all different sizes, and I mean, I look at those. I'm not going to count the people that all fit into one group. I'm going to look at all different types of people.
Yes.
So in my mind, I'm collecting that data. That's part of the practice of medicine. I'm going, okay, so I've tried this one thing on all these different ages and sizes and medical backgrounds, and it doesn't work.
So you have created, in pursuit of your ability to follow the Hippocratic Oath and to practice medicine the way you were trained and that you passionately believe you should, for the most efficacious return for the patient, you have created kind of a unique entity. You're outside of the mainstream in terms of medical practice as it generally is done in the United States.
Yeah, I'm ahead of it.
Yes.
Hopefully, I'm ahead of it.
Hopefully more doctors are coming the way
more
you're coming.
doctors are going to do this and come into different types of practices that center on the patient. I mean, that's all it's about is one
patient-centered medicine. Yeah.
Patient-centered medicine. And what we're looking at is group-centered medicine.
Right.
And there's nothing about that. The doctor-patient relationship's important. The nurse-practitioner patient relationship's important.
Right.
The counselor-patient relationship's important. All of those things are important. There's something in medicine about touching somebody, being in the same room with someone, that actually makes them better.
Yeah.
And that's completely ignored in the system. I mean, it's like get them in, get them out.
Yeah, I want a
physician. It's like being on a conveyor belt.
I want a physician that I know who knows me, that I can call or talk to, who knows who I am.
Right.
And I'm not just one of 5,000 people in a computer data bank that they have responsibility for. That's harder and harder to come by.
Yeah, it's almost impossible. We're also going to run into...
In part because of what are called unfunded mandates.
Right.
So
the cost of doing medicine has gone up, and it's gone up exponentially, while the fees for medicine have gone down. So we don't get cost of living raises from the insurance companies. Everything goes down with what Medicare decides to pay. So our fees are not linked to what we do. So having said that, then the government gives us all of these, you have to do this, you have to do that, and all of those things cost money. So one of them is that is HIPAA, which is the privacy laws. And if you guys think that that's really privacy, take another look, because your insurance companies get a pass. They can know everything about you. The government gets a pass. They can know everything about you. And now that they've taken that and made it the responsibility of the physician to protect your data.
Right.
That's not my job. My job shouldn't be that. My job is to make people better, not to protect the data. But they've made us put records, or everybody who takes money from the government has to have everything on a computer. Well, computers get hacked.
Yeah.
And if a computer gets hacked in this new HIPAA law that came out in January, it's the doctor's fault if we're hacked, or if somebody steals my laptop. And that's crazy, because
okay, so I come to see you.
I have to pay $100,000 if that happens. Doctors don't have that.
I come to see you. Your contract, your relationship, your commitment is to treating me.
Right.
In order to do that and get paid by law,
or just do it.
You have to keep certain.
I could not charge you and still have to follow this because the government's required.
You have to keep certain records that have to be digitized and on the computer.
Right.
And then they have to be handled a certain way. But what you're saying is that the new regulations say that when that leaves your computer and goes to wherever you send it, that you're responsible for how they handle it. So if you send it to a data storage company, say I quit seeing you and 5 years have gone by and you don't want me on your current laptop, but you still have to have those records. So you take them and you store them and you put them in a storage company. Then the storage company employee is bored and sits there and goes through the files and says, oh, I know this guy, and look at my stuff. That you're liable?
Yeah, I'm liable.
That's a challenge.
It's a challenge, and it's not really fair. If the government wants us, make them responsible for it. I mean, if they want us to have this Privacy Act, which isn't privacy, because your insurance company knows everything about you, and your pharmacy knows everything about you, and I mean, it's crazy. It's not really
what you may not know in terms of HIPAA and the costs of HIPAA, the administrative costs of HIPAA that directly go to Kathy or to me if we run a practice. In my practice, we had an appointment book that we laid on the desk, and we'd schedule appointments. And people would come to the desk to write a check, and the appointment book was laying there.
Right.
The HIPAA law says you can't do that. You can't lay that there because somebody leaning over the desk might look at it and see someone else's name.
But you're sitting in the waiting room. Should we have individual stalls that we lock you in the waiting room?
I'm just telling you,
so no one else can see that you're there.
You can't use that system, buy a new one, here, get a computer. So then we bought a computer. We put it all up on the computer. So people would come to the desk to pay their bill, and they'd look at the computer screen, and they'd see the appointment blocks.
Right.
So then they said, oh, you can't do that. You have to buy a mask that goes on the computer that blocks their ability to see the computer.
Right.
Well, all that's money I have to spend in order to treat you,
Right.
for which I'm not getting any more money from you or the insurance company.
Or the insurance company.
And now, having done all those things, I still have a liability risk for what happens to that information 5 years after you quit coming to see me.
Right.
So there are costs that I then incur in order to be in practice to serve you that I cannot recover. And
That you can't charge. You could if you
get
were
it from
doing
you.
a practice that's cash, but everything that comes down from the government, you don't want to charge your patients for.
Right.
I mean, it seems, so you absorb it and you absorb it until you find out that your profit's gone,
Yeah.
and then you have to do something. So then it goes back to the patient again. But HIPAA laws are, they came out with one set, and okay, get this. Everybody in my office had to take a test and
Right?
pass it.
Yes.
And it was the stupidest test. By the way, it was if anybody's listening from the government, it was written poorly. It was not in actual English. The questions that you had to pass were not,
You have to create and train a HIPAA compliance officer who then has to administer it.
We did it online, but we had to pay somebody for
Right.
each test that was done by
Right.
each employee.
Right.
And that means everybody.
Yeah.
And so we had to take the test and pass it. And my estheticians don't do this stuff.
Right.
they're in my office. They had to take it.
So they have to take it.
We had to actually explain what that sentence meant.
Yeah.
It's so complex
Yes.
that I, as a doctor, got an 85. Now, because some of the questions were written so poorly, I should have gotten 100. It's, big deal. But it was written so poorly that it could have been either answer. So they make us do that. We have to send that in. So if you think Big Brother's not watching, he is, or she is. So Big Sister's watching. Anyway, so that's HIPAA. But then the other unfunded mandate was that anybody taking Medicaid or Medicare or any insurance had to become paperless. I'm not. But
Because you don't deal with the insurance.
Because I don't deal with insurance.
Right.
So everybody had to be paperless by this last January, or they weren't going to get paid from these agencies when they took care of patients.
Which is a cost efficiency mechanism for the agencies, but it's cost shifting. Because it
to us.
takes it out of their budget
An
and
EMR,
puts it onto yours.
an electronic medical record, runs from $80,000 to $150,000, depending on your office.
Yeah.
And if you only have a few doctors, that's really, really difficult. And then every computer costs something, and every laptop costs something, and
backups,
and so
and
you're
storage.
looking at a huge amount of money that the government demanded that we do, or we have sanctions and all kinds of things, and then you're on, all of your stuff's not just in my office. It's all over the country. It's everywhere because it's stored somewhere, when we send it.
And they want it to be transportable.
Because they want to see it.
They want to be able
The
to access
government wants
it.
to be able to see what you're taking.
Yeah.
They can see it, but your neighbor can't see it. Your
Right.
husband can't see it. Your children can't see it.
Right.
So, so that is how crazy this is.
Oh yeah, you go to your
And-
doctor's office, you have blood tests done, and they say, well, we'll call you with the results. And you say, fine, leave them on my phone or tell my wife.
We can't
and
do
they
that.
say, oh, HIPAA won't allow us to do that. So then they call you, then you call them back, then they call you, then you call them back. That takes time and
know.
money to play that game. It's really,
It's crazy.
as I began this conversation, to say it is frustrating, and it is depressing, and it is angry-making, and it really doesn't have anything to do
With medicine.
the sacred contract between the physician and the patient about the patient's health care. It has to do with this system's effort to structure, fund, provide access to large numbers of people to a modicum of good medical care. And they're worthwhile goals, but the efficacy and the management of the system is chaotic. And so as a citizen and as an informed consumer, you need to get involved in talking to all these different entities about what you want done, about how you want it organized, or how you and your physician together want it done, so that you are a participant in the conversation, because these are not set in concrete. This continues to evolve, and as it evolves, we are all impacted by it. So please become involved as an informed consumer. become knowledgeable about these issues that don't directly have anything to do with why you have a headache, but are causing a lot of headaches.
And your doctors may not be there because they finally throw their hands up and say, I'm not doing this anymore. And so that's going to give us a huge deficit of doctors. That's going to be a problem for all of us who are, especially who are over 50, looking for
Who need doctors more than we used to.
Yeah. So one last thing. I heard somebody say that some young person was saying that they should, one of the mandates they thought would help with accidents and stuff would be to take driver's licenses away from everybody over 65. And I started laughing because, you know, this 30-year-old has no idea what it's to be 65 nowadays is like, you got another 30 years to live maybe, you know? So that's ridiculous.
Who's going to drive me around for 30
right.
years? I am 65.
That's right. And where are we going to live? We're going to have to live, you know, in an apartment where we can walk to everything. That's, you know, but those are the people that are making decisions about our health care right now. Because he was in that kind of a job. And I just started going, oh my gosh, you guys are in charge of deciding how we're going to be taken care of. Really, people may not like doctors, but honestly, the doctors are more responsible and more reliable and more on. Well, they have a commitment to you, but that I don't think the government has. And I think you may not. You know, we're all kind of weird, but we wouldn't be doctors if we weren't. But you can trust them more than you can trust a huge agency making rules for everybody. So please help us out if you can.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. You can find Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth. Find Brett Newcomb at brettnewcomb.com.